People think of nonprofits in images of rainbows and balloons, children running, families hugging. Look at their websites and that's the kind of thing you'll see. But the truth is that humanitarianism often comes from a much darker place. Abuse, disease, war, and hand grenades. Unfortunately, moments come where humanity must decide who lives and who dies. It is Monday, August 29th, 2005. At 6 a.m., Hurricane Katrina hits landfall in Louisiana. At the Memorial Medical Center, they have lost power. There are backup generators, but then the levees break. There are approximately 250 patients in the hospital. There is no air conditioning. Temperatures reach over 100 degrees Fahrenheit and the water is rising. The only way to evacuate patients is via a helicopter, 1 or 2 people at a time, and there are 2 high water trucks. Even with incredibly skilled doctors and nurses on staff, it is not enough. Many of these patients require oxygen tanks to survive, but those tanks are running out. The most difficult decision comes. Who should get the oxygen? Who should live? And in the same breath, who must die? Perhaps to create a policy around this, we might ask leading doctors or philosophers. But what if we asked you? What if we asked everyday citizens for their opinions and perspectives? That is what the state of Maryland and Carnegie Mellon University wondered. To help inform public policy that could help these tragic scenarios, they created an opportunity for discussion and feedback through a town hall format. Here's how this study and exercise on the value of life was conducted. There were 13 town halls with between 8 and 45 participants. In each of these town halls, the following scenario was described. There's a pandemic influenza. Millions of people are sick and some are dying. The only way to get better is with a ventilator, but there are simply not enough ventilators. There are too many patients and too few resources. 2 critical questions were asked of these town hall participants. What should we do in situations where there are more patients needing ventilators than there are ventilators to use? And perhaps more directly, should healthcare providers ever be allowed to remove a ventilator from one patient who needs it to survive and give it to another patient who also needs it to survive? There were 6 proposed ways that this decision could be made on who gets ventilators. The first one is simple. First come, first serve. The next option was by lottery. Patients are simply assigned a number and healthcare providers pick somebody at random. One way to select who got a ventilator would be to prioritize people by the likelihood of them surviving, the best chances to survive that flu illness. Or perhaps patients who are likely to survive the most number of years are given the priority. Then there is the life cycle principle. Prioritize those patients who have lived through the fewest stages of life. For example, should you save an infant that may have a life expectancy of only 30 years because of a disease, or should you save someone who is already 30 years old who will live till they're 70? The life cycle principle would favor the infant because even though it wouldn't live as many years, it would live through more stages of the life cycle. Lastly, there is the value of the patient to the pandemic that could be considered in prioritization. Which patients are most likely to have an immediate impact on society? Perhaps first responders, clinicians, or vaccine workers should be spared. What would you do? How would you prioritize who survives and why? Even for some medical professionals, this may seem like a far-off scenario without much practical application. So let's relate it to your life. We have many decisions to make as it relates to the value of life. What nonprofit do you choose to donate to? Who do you volunteer to help? What do you vote for? What are we going to teach our children about the value of life? This is truly an uncomfortable scenario, but it is undoubtedly a humanitarian one. Perhaps by contemplating it, we can get closer to understanding our own philosophy as individuals. Maybe that could have an impact on our everyday choices. So what's it going to be?